then a freezer cabinet. And this freezer cabinet is actually filled with tubes of water. And when there was energy, those tubes of water would freeze. And when there was a power cut or no energy available, the ice would slowly melt and diffuse the cold inside, which would allow to go from a few hours of, or one day of holdover time up to a week of holdover time. So already we went from a few hours of autonomy to a week autonomy, which was already a quite large revolution for actually the refrigeration world. And so that was our very first invention. Unfortunately, we did not have the expertise then to patent our inventions with IP. And today still, the technology which is used is derived from this technology that we launched many years ago. In 2000, actually, a whole division from Electrolux became independent under the name of Dometic. So actually, Dometic was one of the 12 divisions of Electrolux, which became independent and which took away out of the group all of the activities and all of the products which were not household appliances. And so in 2000, we became independent. And then we actually launched our second innovation wave of products. If you remember, in those days, Europe was very, I would say, diverse in terms of standards, in terms of regulations. You have the French standards, you have the DIN German standards, you have the British standards, you have the Austrian standards, you have many different standards. And every standard was very different one from the other. And in those days, Dometic had the approach of saying, look, we want one single product to be developed which would comply to all of these national standards with the same product and be able to ship those products anywhere in the world. And that was actually the first, not evolution, but revolution, because it's in the years 2000 that Dometic launched the gold line of products. The gold line of products were refrigerators and freezers, which were the very first in the world capable of communicating both ways. And I could, from here in Luxembourg, connect to a refrigerator or a freezer that was standing in New York or in Bogota or in Dakar in Africa, and know exactly in real time how it was working, but not only how it was working, also it was capable of giving a diagnosis of the operation of the equipment, meaning that a technician, before going on site, already knew what was the issue with the refrigerator or the freezer. He knew he had to take a compressor, he knew he had to take a relay, he knew he had to take a fan. So it was really an intelligent, these were the very first intelligent refrigerators and freezers existing on the market. Being part of Electrolux in the 1970s, being part of Dometic in the 2000s, the Luxembourg entity still had a small frustration, and that was that we had many more ideas and not enough funds or group priorities that were allowing us to bring those ideas to life. And so between 2000 and 2015, the management here in Luxembourg had tried to do 5 management buyouts. And finally, in 2015, we succeeded to do a management buyout here in Luxembourg. And this was together with a private equity from Malaysia, which was called Navis Capital. And 2015 was for us, again, a very important year, because Navis Capital really brought a lot of financial means to the table, allowing us to develop much faster and much more. And just to give you an idea, before 2015, the R&D team here in Luxembourg had 4 engineers which were dedicated to the medical refrigeration. The other engineers, a few others, were dedicated to the automotive industry, to the food and beverage industry, and to the military industry, which were 3 other activities which we were doing here in Luxembourg. In 2015, we went from 4 engineers to 30 engineers in less than a year. And we focused really very much on our medical activity, because that was really the backbone of our company and really the focus that we wanted to work on and develop in the future years. In 2022, we became part of a US life science company, which is Azenta Life Sciences. And it is only here in almost 2024 now that we are seeing the huge benefits of being part of a large life science company. And I'll come to that a bit later in the presentation. Next. So actually, what is important to know is that our company today has more than 500,000 equipments installed across the world, and more than half of the world's children have been vaccinated by vaccines that were at some point of time stored or transported with our equipment. Also in the pictures that you see on this slide, you can see the very different types of environments that we work in. If you look on the middle point on the left side, you can see, for example, a freezer bay. Typically, these kind of freezer bays you will find in pharmaceutical companies like Pfizer, Novartis, GlaxoSmithKline, Sanofi Pasteur, where actually the environment is very much controlled in terms of power supply, but also in terms of ambient temperature and cleanliness. On the other pictures, many of them, you see that our products really go into the jungle, they go into the bush, they are transported by trucks, they are transported by airplane, by helicopters, you name it. And it's this unique expertise that our company has of having high quality, high-end products in very controlled environments, and then also high-end, high-quality products in the worst places in the world that you can imagine. It's the desert of Chad, it's the Amazon jungle in Brazil, it's the forest in Congo, and where really the environment can be very dusty, very humid, very aggressive to electronical equipment as we know it around the globe. Next. So today, the activity of our company is subdivided in three different market segments. First of all, and the largest by far, is the vaccine cold chain. And typically you will recognize our products because they are rotomolded in one single piece out of plastic, polyethylene or polypropylene. And I think this is a very famous signature of our equipment. I was in a meeting with the president of Madagascar a few months ago, and he did not know from which company I was. And talking about the vaccination programs in the country, he said, yeah, but in our country, we have these famous blue refrigerators. And when I announced him that these blue refrigerators came from B Medical in Luxembourg, the conversation completely changed, and there was a fantastic, I would say, recognition that very many people recognize and know our products. They just don't know it's coming from Luxembourg and where they are built and what they entail. So the vaccine cold chain is the largest part of our activity. Then also we have medical refrigeration in the middle of our activity. And again, to show the expertise of the engineers that we have here in Europe, I was mentioning a bit earlier that all of these different countries, France, Germany, England, Holland, Belgium, they all had their own typical standards in the healthcare. And recently, the European Union made the EU regulations. And B Medical was the first company in the world to have obtained the EU certificate for medical refrigeration, which again shows the level of proactiveness that our company has and the expertise that our company has, not only in building quality products, but also being ahead of the competition in terms of certification and international regulations. The third leg on which we stand is actually the blood management. And the blood management solution is, again, a very particular activity. Why? Because blood transfusion is an activity where the regulations are very, very, very stringent. They are so stringent that we have many competitors on the medical refrigeration segment which are not capable of entering the blood management segment because the regulations are so severe that they cannot succeed to pass these regulations. Just to give you an example, when you think about a refrigerator in your home, you always say that you put the vegetables on the bottom, you put the butter and the milk on the top. And that is for a very simple reason. That's because the temperature inside a refrigerator can vary from 8 to 12 degrees. And that's why they say the coldest part is on the bottom, the warmest part is on the top. But for a medical refrigerator, the difference in any different point of a refrigerator is 1.5 degrees. You could say, okay, that should be simple to do, but it's actually very complicated. And we have, for example, competitors since decades who have not been capable of having this tolerance of 1.5 degrees diffusion in a refrigerator. And that's again where B Medical excels in terms of expertise. And one of the most recent activities which we have added as a layer on top of all our technology is the real-time monitoring solutions. So be it a product from the cold chain, be it a product from medical refrigeration or from blood management, all of our products today are connected in real time. This also brings a lot of capabilities, new capabilities to our customers, but also to our company in terms of development. I very frequently have meetings with UNICEF, where UNICEF come to B Medical and ask us, can you tell us what the cold chain in Congo is doing, or what the cold chain in Nigeria is doing? And we, just with a click of a button, can tell them exactly how much percentage of their vaccine cold chain is up and running, capable of doing large national campaigns against COVID, for example. COVID was a very nice example where our expertise really came to the surface and really showed the power that our R&D brought to the market, and the really efficient solutions with a lot of visibility for the ministries of health. Next. So if we go a bit more deeper into the vaccine cold chain, so we have really a lot of unique solutions, which I will actually explain to you more on the last slide, where we talk about our innovations and patented innovations. But here, just to give you a couple of indications on the different families. So we have the solar direct drive refrigerators and freezers that you can see on the first bullet. And actually, what are those refrigerators? These are refrigerators which work on solar panels directly. You could say, okay, but solar refrigeration exists since many, many years. Yes, you are correct. Solar refrigeration exists since many, many years. But the refrigerators that were solar existing in the past all needed a chemical battery to be backed up in case of rainy seasons, in case of absence of sunshine. And today, B Medical has developed the very first product which absolutely has zero batteries, and which is actually technically outperforming the solar refrigerators with batteries. And again, that is expertise that B Medical brought to the market, which today everybody is trying to copy, because it really eliminates all of the weaknesses. Very often our products are going to developing countries where the financial means are limited, and where certainly they do not have budgets for operational costs. So what you need to do as a manufacturer is to bring to the market a product which has close to zero, if not zero, operational costs. And that's what we have succeeded as the very first company globally. We have brought products to the market which work directly on solar energy, which have zero consumables, and by having no battery and no battery charges, there is no more weakness into the system, no more consumable that needs to be supported with extra funds. And that really makes a country totally independent and autonomous in terms of its vaccine cold chain. We also have a lot of AC/DC refrigerators and freezers. And again, there we excel in our capability of providing very robust products, because in many, many countries, yes, AC is available, but the quality of the AC power is a disaster. And very often you have peaks in electricity, either in voltage or amperage, which really damage or completely burn your compressors, your electronics. And we have developed products which are capable of taking any voltage from 12 volt all the way to 380 volts. So it can be very dirty power without damaging the electronics or without damaging the compressor. And that is very, very unique. And thanks to that technology, our failure rate, for example, in a country like Afghanistan is 0.3% that we have as failures. And our best competitor is above 50%. So that really shows you the difference in terms of quality and technology that our company is capable of bringing to the market. The vaccine transport boxes is a product which we have been selling for many, many years. And then the ultra-low freezers, which have come to light, especially during the COVID, because with the Pfizer vaccine, when Pfizer announced that the technology used for the vaccine for Pfizer was mRNA technology coming from cancer treatments and oncology, in a few hours, our entire stock of ultra-lows in the United States was sold to different US companies. And the particularity, again, from the ultra-low freezers that B Medical produces, we are the only company in the whole world who have -80 freezers, which are capable of working and operating in tropical conditions. And that is also one of the reasons why many of our products are very much appreciated by the military, because very often when the military are in deployment activities in other parts of the world, be it Afghanistan, be it wherever around the world, the fact that they have robust equipment which does not rely on air conditioning and external power supplies is a huge advantage. And again, during COVID, I was visiting the National Immunization Center in Nigeria, in Abuja, and that was a fantastic showcase for us, because the air conditioning had dropped out, and all of the ultra-low freezers that were in the National Health Center were all failing, except for the B Medical one, which was continuously working. And I would say this expertise goes beyond the ministries of health and beyond the other, I would say, medical equipment companies. We have been recognized by a company, a global company like Toyota. Toyota came and knocked on our door, asking if we could not co-develop a product together which was capable of distributing vaccines in the most harsh and most remote areas around the globe. And together with Toyota, we developed a Land Cruiser, a Toyota Land Cruiser, which has been modified, which has an autonomy to ride in the jungle and in the bush for 2,000 kilometers with a single fuel tank, and capable of maintaining the vaccines in safe temperatures, which again is unique. And still today, we are the only logistic product which are qualified by WHO. So nobody else has succeeded so far to qualify a similar product. And this is not the only example. I will come to a couple more examples later down, showing again the expertise that we have in terms of bringing technology to the market. Next. On medical refrigeration, again, we have developed quite a lot of unique solutions. And maybe one which is interesting to mention is the second one to the left, which is the UT31. I was mentioning to you that Pfizer, when they launched the COVID vaccine based on mRNA technology, one of the particularities was that you needed -80 temperature to store safely the vaccine of Pfizer. And it is not only the Pfizer vaccine, even the Ebola vaccine, if you think about the Ebola vaccine, which is also a vaccine which is very sensitive, also needs -80. But because the Ebola vaccine was mainly addressing the Congolese market, other people did not worry about -80. But today, with the COVID experience that the globe has had, many people are aware that going forward, this might not be the first and the last pandemic that we have. And we know that we will in the future have to rely on -80 capabilities to bring vaccines even to very remote populations. So B Medical has thought again, what can we as a company bring as new technology to allow the medicines and the vaccines to reach the remote populations in safe and secure conditions. And we developed the very first solar -80 freezer capable of storing even in remote villages, capable at -80 degrees, which is very, very unique. And then typically you will have traditional products like laboratory freezers, ultra-low freezers, which are again unique. And maybe also if you remember the COVID, because I mean, we've all been very close to the COVID experience globally. One of the challenges that many governments had is, what do I buy as equipment? What do I need to equip my country with to be able to store any of the vaccines? Do I need to have equipment for -20, equipment for -80, equipment for +4? Because there were different temperature profiles for vaccines. And B Medical, again, brought to the market unique products like the ultra-low freezer, which is capable of not only providing -80 degrees, but the same unit can produce -20 degrees. Again, you could think, oh, that's very simple to do -20 with a -80 unit, but it's very, very complicated because the technology, be it ours or any of our competitors, they inject the cooling component at -90 degrees. And so to create a -20 environment with a starting point of -90 is very complicated. But we succeeded to do it, and we succeeded to get it certified by WHO, again, as the only company around the globe having done that. Next. As I mentioned also earlier, so blood management is something where we are, again, very unique. And here I would like to take the example of the product that you see in the middle, which is the contact shock freezer. When you donate your blood, the blood is being taken for three components. It's for the platelets, it's for the plasma, and for the red cells. And actually the plasma is one of the core components which is used by the pharmaceutical industry to produce medicines. And the plasma, the quality of the plasma is also defining the quality of your medicines. And the quality of the plasma depends on one single aspect, and that is to be frozen to -35 degrees as quickly as possible. The quicker you freeze, the higher the quality of your plasma will be, and the better medicines that you can produce with that plasma. And today, still today, after several years, B Medical is the only company in the world who has been capable of producing a machine which is totally user independent. So if you have a good operator or you have a bad operator, the quality of your fresh frozen plasma will always be the same. There is not a single competitor who has a product which can do the same. If you have with the other products, with the competitor products, if you have a good operator, you can have good plasma. If you have a bad operator, you will have bad plasma. And that is something where, again, we outperformed many technologies and many competitors, because we are the only company producing a unit which is totally operator independent. Next. And as I mentioned, one of the aspects that we have is the remote temperature monitoring in real time. And there we really excel. When in 2013, we launched the technology of remote monitoring for the vaccine cold chain. Actually, we had a lot of resistance from UNICEF and WHO, because they considered that B Medical already was almost in a monopoly situation due to the quality and the innovations that we were bringing to market. And by bringing this remote temperature monitoring to the market, again, we would be in a much stronger position going forward. And today, we are the single largest source of data for the Ministries of Health, for the Bill Gates and Melinda Foundation, the Gavis, the Global Alliance for Vaccines and Immunization. We have access to hundreds and hundreds of thousands of data accessible to the Ministries of Health, which allow them to be a lot more efficient. Why? Because if you look at a country like Congo, which is 7 times the size of France, the Ministry of Health of Congo only has 35 engineers to cover thousands of refrigerators, which are in very remote locations. Sometimes you need to take a canoe for a week to reach the village, and just to see, okay, the unit is working. I did my trip for nothing. I'm not needed here. And in other locations, they are needed and they don't reach it. With our system in real-time monitoring on Google Maps, you can see exactly where the unit is standing and how it is performing. And thanks to that, the few technicians that they have at the Ministry of Health are sufficient to cover the entire territory. Next. So we have really a complete cold chain going from +4 degrees to -86 degrees. And now that we are part of the Azenta Life Science company in the US, they even go to -196 degrees, which is cryogenic temperatures. And we're actually, the expertise of B Medical and the expertise of Azenta coming together is going to open new doors for our company and open new opportunities. Already today, we are working on opportunities where actually Azenta alone could not manage to bring a solution to the market, and B Medical could not manage to bring a solution alone to the market. But together today, yes, we can. And it's these synergies that we want to develop in the next few months and years. Next. Also, what is very interesting from Luxembourg, and that I also am very proud of, and it's the international environment that Luxembourg offers to the companies. Here in our company in Luxembourg, we have more than 26 different nationalities on a staff of more or less 350 people here in Luxembourg. And also we have a lot of people who have a lot of expertise. I myself have been with the company for 24 years, but as you can see here on the graph, 47% of our people have been here for more than 15 years. And what I'm also very proud of is that many families, they have brothers, sisters, fathers, daughters, sons working in the company. And I think that really shows that there is a real mission and a real belief in working for a good company by bringing your family in to work for that same company. And that's something really that I'm very proud of. Next. In terms of the different facilities that we have now around the globe, so we have our entity in the US, which is in Noblesville. We have B Medical Systems in Hozingen, which is the north of Luxembourg, and which is the headquarters of the organization. And since 2 years now, we have also our manufacturing site in India, which is situated in the state of Gujarat, in the city of Mundra, which is actually the single largest seaport of India on the west coast, which actually gives us a very quick access also to Eastern Africa in terms of supply of large quantities of equipment, which again reinforces our international position globally. Next. Keeping a bit tight on time. And here is actually something where I really want to point out the innovations that we bring. The innovations that we bring in terms of technology are very often now protected by patents, because we have learned our lesson. It's really fantastic to bring innovation to the market, but you also need to be conscious of competition and make it really hard to design around. And actually, if you look at the two bottom ones, the Ultra 16 and the RVTV, the vaccine distribution vehicle, these are actually two products where actually there is no history. They did not exist in the past in such a way that even WHO had to create new certification categories to allow donors like the Gates Foundation, the World Bank, the Japanese aid to be able to buy with donation money these kind of products now that they are WHO certified. This is something which is unique, and the Ultra 16 is actually a fantastic refrigerator which has an autonomy of 1 month. So you can maintain the temperature during 1 month, and many of these innovations are really unique. If you think any of our competitors, the very best autonomy that they can offer is 1 week. The best autonomy that we can offer is 1 month. So that really, for example, gives you access to markets like Indonesia. Indonesia is made out of 12,000 inhabited islands, and the entire cold chain of Indonesia is based on gas and kerosene refrigerators, which you need to supply with gas and kerosene continuously to have a safe working vaccine immunization cold chain. With our system, you can just plug it onto the solar panels, and you do not need to supply any gas or any kerosene. It's autonomous and can work on its own solar panels very safely, even during the rainy season. Next. So we have a lot of capacity in terms of advanced research and development. A lot of our R&D activity used to be based on trial error. But since that we now have 40 years of experience and data, we have put all of these data blocks into a supercomputer, and we do a lot of simulation, which accelerates very much the development process of new products. And we see that with the supercomputer simulation, we can optimize the products before even making the very first prototype. And we see that the reality between the calculations and the first prototype is very similar, which again increases our capacity to develop new products. And I think we're almost to the end of my presentation. Here's a few pictures of the manufacturing sites that we have around the globe. So Mundra, Luxembourg, and we have really a very high capacity of production. We are capable of really supplying large quantities in a very short period of time, not only to supply, but also to install in the different countries. Next. We also have more or less 15,000 products which are ready to be shipped from Cargolux at Luxembourg Airport. So we can really, really move fast on countries where there's an earthquake, where there's a human crisis. For example, we had a call during COVID from the Nigerian government on a Tuesday, asking us for 13,000 products on Thursday. Even we could not make it, but the following week, we did send those 13,000 units. Next. Also, I was talking about the green aspect. We have been one of the first companies to produce green refrigerant equipment with natural gases. Also, we have many different certificates, ISO 14001, ISO 9001, many others. Next. Also, in terms of our customer base, we're very much spread all over. Same with the vaccines. We have really stored every single vaccine that came on the market during the COVID crisis in our refrigerators, freezers, and transport boxes. Next, this one. And that was it. So I hope we still have some time left for questions, but I would really be curious to see what thoughts popped up during the presentation. And thank you for having given me this opportunity to present our company and our innovations.
Thank you very much, Luc. I think it was very interesting and very impressed about all the different products you have and your capability of helping so many people and countries around the world and how efficiently and quickly you can do it. So really my compliments for that. We have a couple of people who asked some questions. So
I'll do my best.
So we have a first one from a lady called Jane Barton. And she's asking, do you worry about industrial espionage and cybersecurity?
Yes, absolutely. I think it's very high on our list, and that's why we very much focus a lot of energy before developing our products to see if there is, yes or no, a possibility to patent our innovations. As I mentioned, in the early days, we did not patent our innovations, and very quickly there were many copies of what we had made on the market. Today, it's almost a must-have, the capability to patent the innovation before we bring a product to market. The industrial espionage, I believe, is something which is very true. And just to give you an example, we were at a congress which was called Medica in Düsseldorf, which is one of the largest medical fairs in Europe. And one morning we arrived to our booth. And if you recall the machine that I was telling you about, the plasma shock freezer, which was fast freezing the plasma. Well, when we arrived to the booth, there was a Chinese individual inside the machine taking pictures. So yes, it's very reality. It's our daily reality. And we really need to protect our products and our innovations with patents. That's very important for us. And in terms of cybersecurity, that also is very high, and we have many securities built in. We have been actually victim of a cyber attack a couple of years ago, and that really was a hard lesson that we learned, and we have put a lot of focus on cybersecurity. And again, I think Luxembourg is really well equipped to offer security against cyber criminality.
Thank you. We have another question from, where did he go now? From Raymond Adam. What is the theoretical lowest temperature possible which you could achieve with your cooling technology, and would that open new markets?
So actually, the temperatures are quite standard in the sense of the need for temperatures. So we go down to minus 86 with our typical compressor technology, and to go down to minus 86, you already need, I would say, a more complex structure. We call it a cascade system. So actually, the first system with the first compressor will bring down your temperature to minus 60, minus 67. And then the second compressor will kick in and bring it down to minus 86, minus 90 degrees Celsius. There are other technologies which allow you to go down to cryogenic temperatures, minus 196, where really you could do storage for even centuries, as long as the system is up and running. So it is not necessary to go lower than those temperatures that we have actually succeeded to do today. What is, I would say, that the future challenge in terms of technology is to bring those capacities to locations where other people cannot guarantee power supply, stable power supply, or AC power supply, and that you have to rely on DC power supply. And that's, I think, the technological challenge for tomorrow.
Right. I have another question here from Antonia Aggio. She's asking, in spite of the technology you have, do you have challenges maintaining the cold chain in African countries?
So, and actually, that's something where we really excel. We excel there, not only thanks to the robustness of our technology. I was mentioning, for example, that we have AC units which can take any dirty power from 9 to 12 volts up to 380 volts. These are typically realities in the terrain which allow to show the robustness of our cold chain. The DC and the solar units are super stable, and those really have an incredible autonomy. I mean, if you can offer to a health center which is remote in the bush an autonomy of 1 month, it's almost impossible that in 1 month time you do not have the passage of a new Toyota vehicle or of a health worker bringing new vaccines or so on. So I think today we really do have a very robust cold chain, even in the most harsh condition. And actually, I was mentioning the Amazon forest, the Brazilian Amazon forest. There have been a lot of attempts to bring vaccine cold chains to the indigenous people in the Amazon forest. And you could say, okay, but why do you need to bring vaccines to the indigenous people in the Amazon forest? And that's mainly because there are a lot of forest activities or mining activities where external populations bring diseases to these populations, and they need to be protected. And B Medical has been the very first company capable of bringing cold chain, effective cold chain, to those locations.
I have a very interesting question here from Catherine Elvinger, who says, oops, it's disappeared. I'm trying.
Can you hear me? Otherwise, I can.
Okay, I got it.
Okay, perfect. Well, thank you so much for the interesting presentation. I would be interested in knowing what you would change in Luxembourg to make it even more attractive for companies like yours to settle here and innovate. I don't know if you had any challenges, and if you could talk a little bit about that. Thank you.
Well, actually, Luxembourg has been for us a fantastic home. I think Luxembourg has really, I would say, a political environment which is very favorable to companies. And I mean, when you have the Prime Minister of Luxembourg making the promotion of B Medical globally, you could not wish for anything better as a situation. Also, the fact that our company has to do with many national and international programs, we have a very, I would say, unstable running rate. Sometimes we have to produce day and night and the entire weekend to hit deadlines. But then you have periods where there's a very low activity, and that's because of the nature of our business. And again, Luxembourg is providing an environment which allows you to cope with such situations. So I think, honestly, for Luxembourg, it's really a fantastic location to be for a company. I would say the only maybe recommendation or wish that I would like to express is the fact that Luxembourg has really a key position within the European Union. And I think at the European Union level, there, I think there is not enough promotion done for Luxembourg companies and Luxembourg technology.
Well, we're definitely working on that now, and we were happy to have you as the first company launching this series of technology made in LU. Of course, there are more companies who have very innovative products which do different things, of course, than you did. But of course, you are unique in the type of product which you produce and deliver around the globe. So really, my compliments for that. I don't see any other questions for the moment, except for people thanking and saying that it was really a very interesting event, and thanking you, Luc, for this wonderful presentation. And I think everybody who was in tonight actually saw the true thing about the company and also what you're trying to do. And I think saving lives it says it all. I mean, so thank you very much, and my compliments again to what you do. I would also like to thank LACC for having joined us and for having a US audience with us tonight. I also want to thank Mr. Steinmetz for having been in there. And of course, our audience in Luxembourg, who I think hopefully learned something tonight. And indeed, as we mentioned already in the beginning, I think there are a lot of people who do not know your company, or who do not know all the good companies existing in Luxembourg who actually qualify for this logo, having technology made in LU. So I encourage, of course, everybody in that respect to follow our next webinars on this topic. And unless anybody has a last word, I would then thank you all for participating tonight, and see you next time.
Thank you very much, Paul. Thank you, everybody.
Thank you, everyone. Thank you, Daniel. Thank you, Luc.
Thank you.
Thank you.
Bye-bye.
Bye-bye. Thank you.